All right, welcome back to the program. It's still Moneyline with me, Nancy. And joining me right now is my guest, Dr. Sani Aliyu, the National Coordinator, Presidential Task Force on COVID-19. Dr. Aliyu, good to see you and welcome to the program.
Good morning, Nancy.
Dr. Aliyu, can you hear me?
Yes, I can hear you. I can hear
you quite
clearly.
Okay, good. Welcome to the program. After months of, after months that COVID-19 came into Nigeria from precisely February 27th of this year, I think we are close to about 7 months of fighting this pandemic, if I still remember my arithmetics. We've seen so far unemployment high at 27.1%. GDP has contracted 6.1%. The cases as at yesterday were like a little over 55,000. Over 43,000 people have also recovered. We've recorded death cases of about 1,061. As the national coordinator against this pandemic, do you think that this pandemic can be brought to its knees without an effective vaccine? When will this be over? Because I ask myself that sometimes.
So I think it's a mixed picture. The key thing that people need to remember is we are really not testing adequately, and therefore whatever we get in terms of the data, it's really limited. So for every one positive we are probably missing between 7 to 10 cases, which we know is true. And the challenge really with testing has to do with the acceptance by the general public and the demand, which simply isn't there at all. When we started off, the key problem we had was the number of laboratories that were insufficient and issues with test kits, etc. That's no longer the case. We now have over just about 68 laboratories throughout the country. Only 2 states do not have some capacity for molecular laboratory testing for COVID-19. But having said that, states like Lagos, for instance, it's very clear that even though they continue to test a lot, they are really not finding the positive cases. And whenever I talk to governors, what I actually say to them is, look, it's in our best interest to look for these cases. And if we don't find them, we open up. So whereas if we continue to play ostrich, we don't test, because we do have states that are completely silent, that hardly test at all. And in those sort of states, we don't really know what's going on. Whereas with states like Plateau, for instance, that have really upskilled their testing, and I must congratulate them for that. We know exactly what's going on, and we can put in place interventions to interrupt transmission. Overall, in Africa, in Nigeria, we're very lucky. We haven't seen the sort of deaths that have happened in Europe, North America, and elsewhere. But this is probably because of the nature of our demographic population. We have a lot of young people. Our median age, I believe, is the late teens or early 20s. Only 3% of our population are above the age of 65, which is why we're not sort of seeing the sort of deaths that's happening in other parts of the world. But nevertheless, even one death is an unfortunate death, since this is really preventable. We need to test a lot more. We need to find out what is truly going on throughout the country. And if we don't have cases, or if the cases are dropping, then we open up and we congratulate ourselves for a good job. But if there are cases happening, then it's our responsibility to make sure we interrupt that transmission, because people are still dying from COVID, even though the numbers have come down. Lagos State has done tremendously well, and we must congratulate them for doing a good job. The numbers, no doubt, are falling in Lagos, and I think we are getting on top of the problem in Lagos. Throughout the country, yesterday, for instance, we tested just about 2,500 samples, which is really, really small compared to our capacity to be able to test more than 10,000 a day. But the positivity rate, only about 6% were positive, compared to the past when we had over 10, 12, 14% positivity. So overall, I think we're starting to get on top of the epidemic, but we shouldn't be complacent. We're still far from Uhuru.
Okay, where are we right now nationally on testing? I know you've just said that, but in terms of you've just also said which 2 states, that 2 states do not have the capacity. So I would like to know those 2 states. And if Lagos State, for example, you said that Lagos State is having some kind of reduction in terms of positive cases of COVID-19. Why is it so? So I've asked you 2 questions in one.
So Nancy, the main reason why the Lagos numbers are coming down is because right from the beginning, they had been testing widely. So their numbers have been up. If you look at the total number of cases, the number of cases in Lagos is threefold higher than the second highest part of the country, which is the FCT, which has just about 5,000. Lagos has about 18,000 or so cases at the moment. The more you understand the nature of the epidemic in your area, the easier it is to interrupt transmission. We have what we call hotspot local government areas, 20 of them at the moment throughout the country. They are responsible for more than 50% of the transmissions that are going on. And we've been putting resources in these 20 local government areas to interrupt transmission by increasing testing, making it easier for people to access testing, etc. But I think it's a mixture of stigma and disbelief that's driving the lack of demand for testing more than anything else. Access, of course, is an issue. As the Honorable Minister of Health said a few weeks ago, we have been working towards making sure that every local government that has a relatively high incidence has access to testing. We're also moving a lot of our tests into the hospitals because that's really where it should be. Now, going back to your next question, your other question about which states do not have molecular lab testing. At the moment, it's Kebbi and Niger State. I believe Kebbi will be coming on stream fairly soon because NCDC are working quite closely with them. Eventually, every state will have a molecular lab, but molecular labs are not toys. It's almost like every state wanted a molecular lab, and the moment you get a lab, that's it. It's like a child wanting a toy, and then they lose interest because these labs are really not being utilized at all properly. A lot of them have not been testing, even though they've been commissioned. The bulk of our testing continues to be in laboratories that have existed for some months now. But my plea, again, to the general public is it's better you know the extent of your problem. If you have symptoms related to COVID, you need to get testing done. If you look after vulnerable groups and you are unwell, it's in your best interest to make sure that you get tested. Yes, the majority will have a mild illness and will get better. But for the elderly ones, it could be a difference between life and death if you protect your loved ones. Our data so far for those above the age of 65 shows about 18% mortality if they get COVID. That's almost a 1 in 5, which is simply really not acceptable. It's a very high risk for those that are vulnerable, and we need to protect them as much as we can.
How much is it to set up a molecular lab? Because I've heard different versions. I've heard sometimes it's not up to, it's just like some millions of dollars, So just tell me, how much is it to set up a molecular lab?
So it's not just the expense, Nancy. It's also the skill that goes into it. It's an awfully complicated technical method. It's not like a normal biochemistry testing, for instance. Overall, it's quite expensive compared to a conventional lab. You also need to put in biosafety arrangements, so you need to have a particular hood in order to process samples, what we call a biosafety cabinet. Your staff need to be highly skilled. They need to be trained on infection control, and you just cannot rush it. An example is with Kano, for instance. I remember back in the early days of the pandemic, around March, April, we rushed to set up a molecular lab in Kano because of the issue of a lot of deaths happening. And there was a lot of pressure to register that lab. Within a week, a large number of their staff got infected with COVID because they didn't really receive the right training properly, and it was all rushed. So we have to be very careful. We now have technology that enables us to put laboratories fairly quickly using the gene expert machines that we've had for tuberculosis, for instance. But nevertheless, the processing itself requires a lot of caution. It requires a lot of consideration. Otherwise, you'll either end up infecting yourself, or you'll end up contaminating the lab, or you'll end up having unreliable results. And that's why with the private sector, especially when it comes to travel-related testing, for instance, we are urging the private sector to come in to complement what government has been doing from the public health side. And I think even with travel testing, the overall number of tests that we'll be doing in the country will significantly go up. At the moment, as I said, we're testing between 2,500 to 3,000 a day. When we are fully open in terms of our international airports, we will be testing an additional 10,000 samples a day. And most of that should be in the private sector. So overall, our testing capacity will increase. And I hope it will also reflect the true incidence of COVID-19 infection in our country.
Should I infer from what you've just said now that the government is looking at models for private firms or private enterprises to come into testing so that to enhance our testing capacity? Are you looking at that more private companies apart from government begin testing to facilitate it?
Absolutely. Absolutely. Well, certainly from the side of travel related, we are urging the private sector to come in and contribute, because we really want to crash the price for testing for passengers. At the moment, it ranges between 35, 40 to 50,000, depending on where you are and the laboratories that are testing. But we believe if more and more labs are set up across the country, not only will the price come down, but it will also be more convenient for passengers. Passengers don't need to stay in Lagos or Abuja or where the airports are. We've just introduced a travel portal, an international travel portal, nitp.ncdc.gov.ng, and travelers can go in there required to register their details and pay for a COVID-19 test when they are coming to Nigeria, so that they get the test done at day 7. And also those exiting can also do that. But for the moment, the portal accommodates labs in Abuja and Lagos. And we're very keen for labs in other parts of the country, particularly the large cities, to start coming in. There are clear criteria for getting onto the portal, and they need to work with the state governments to get accredited, and with NCDC for validation and optimization, as well as the Medical Laboratory Science Council of Nigeria for registration. But once that's done, they'll go onto the portal and they will be able to test. Molecular laboratory testing throughout the world is very sensitive, and the possibility of false positive increases as your prevalence of a disease comes down. Because even though you might have a sensitivity of, let's say, 99%, you'll still be having false positives in 1 in 1,000 or so if you test widely. So that's why we really need to get it right. We don't want to be having a lot of false positives, especially as our numbers come down. But overall, the news is that I think we're starting to get on top of the COVID problem in Nigeria. Let us please test more and more so that we can be absolutely confident of our position and we can start opening up our economy as soon as possible, and our schools, etc.
Dr. Aliyu, about the school of thought that perhaps we're having a reduction in COVID-19 cases because we have the young population, as you said earlier. Demography seems to be helping us. Perhaps that some people that will have mild symptoms and co, they won't even go for testing. So if you don't test, you don't get the results. People don't approach the health authorities anymore for testing. So perhaps that's also what's bringing down our numbers.
Yeah, absolutely right. We need to test more. Ideally, we should be testing at least tenfold what we're testing now in order to have the true picture. But having said that, there are states that have been testing relatively at the same rate as they were about a month or so ago, like Lagos and FCT. And the number of positives has been progressively coming down in those areas. So we can be confident that in those areas we're starting to get on top of the problem. There are also indirect markers that we can use to know whether or not the COVID problem is still ongoing, such as the number of people presenting to hospitals with severe respiratory illness. And certainly both in Abuja and Lagos, we have seen a drop in the number of severe cases presenting. The number of people on intensive care, for instance, has fallen. For a lot of states, the treatment centers have either closed or have reduced in size. In Abuja, we now have beds that are now available, whereas at the peak of the epidemic in Abuja, we were really struggling to get people into care. So I think for some parts of the country, it's really good. For other parts of the country, not only are they not testing, they are not even following the normal non-pharmaceutical interventions that we expect. And if you don't put on a face mask, if you don't maintain physical distancing, avoiding mass gatherings, etc., at a population level, what will happen is the virus will just spread throughout the population, and at a very early stage, you will end up having a degree of herd immunity, especially if your population is a young, mobile one. So what you probably find at the end of the day is you will achieve a degree of herd immunity much earlier, and the overall number of cases will start dropping. But as I said, this is not a reason for complacency. we've got to start testing a lot more. We are looking at expanding testing. We've already relaxed on some of our measures in terms of our indicators for testing. We are urging states, you don't need to have symptoms in order to test a person. If somebody is looking after a vulnerable person, that in itself is an indication for testing. If they have underlying immunodeficiencies or diabetes or other illnesses, that's another good reason for you to know what your status is. If you have been with somebody who was positive, then you really need to know so that you prepare yourself and you monitor yourself properly if you happen to be positive. And also, as we open the NYSC camps, etc., we will be looking at the prospect of testing within large gatherings such as NYSC, because that will give us a fairly good idea of what's going on in other states. So, for instance, if you have corpus coming from other parts of the country and they are congregating in a particular camp, if we test them knowing where they are, it will also give us some idea of what's going on in their states without necessarily being in their states for testing. So all this is coming through. The only way you can get on top of the epidemic for the country is by doing 2 or 3 things. 1, making sure that you test a lot. 2, enforcing the non-pharmaceutical interventions that are there. And then thirdly, making sure that as you move forward, you've put in place processes to stop people from catching it. So like the issue of risk communication and engagement right at the community level. For instance, we're meeting with the Northern Traditional Leaders Council this Thursday, and we'll be urging them to take back the message to their communities, because we know that it's also about getting the right message through and having the right messenger delivering this. People really need to know that we still have COVID very much around within the country, and we need to continue to take those measures. They may be inconvenient, but eventually COVID will go away and we can all release ourselves and stop wearing face masks. But for the moment, the fastest way of getting back to normal is by protecting ourselves and using those non-pharmaceutical interventions that everybody finds incredibly inconvenient.
Hello YouTubers, welcome to Moneyline with Nancy TV YouTube channel. This is where we provide you with instructive business directions, processes, and guidance to help you assess the right resources to fund your businesses to withstand every form of internal and external shock. You will find here awesome informative videos on business, entrepreneurship, and lifestyle just to help you make informed business and financial decisions. Punch the subscribe button and let us drive you through the world of business. Please follow all our social media platforms on Facebook, on Twitter, on Instagram, on LinkedIn, and follow us for latest updates on our website. Dr. Aliyu, for those that do tests, because I've also seen some that would undertake tests and it would take quite a while to get the results. Have we improved in that? Because if it takes a while to get the result, there is the propensity of that person that is awaiting the COVID test to also reinfect others.
Yes, indeed. And I think a negative result, Nancy, is just as important as the positive one in terms of sending out the right message and giving people confidence. With NCDC, they've actually tried, because they've now introduced an electronic method for releasing results. I think it started off in the FCT. So if you have a test, you will get an electronic message to say that your result is negative, or you can log on and enter your EPI number, and it will tell you whether the result is negative or not. Obviously, as the number of cases went up, we have been prioritizing the positives, because it's easier to phone out a positive result than to call out a mass of negative results. But overall, if you don't hear anything from NCDC, I know this sounds really bad, but if you don't hear anything from NCDC or from where you were tested, the likelihood is you probably did have a negative result. But nevertheless, it's important that communication is really essential. In parts of the country, like Lagos, for instance, if you have a positive result, we are no longer isolating people in facilities. They do home isolation, and they have quite a good method of monitoring. But for places outside Lagos, we still have a lot of beds available. Overall, we have about 7,000 beds in the country for isolation. I would prefer calling it isolation, not isolation and treatment center, because if you have COVID and you don't have symptoms, you don't really need to take anything. All this chloroquine, multivitamins, and zinc, etc., are really not necessary. All you need really is to make sure that you are being monitored You're not developing a temperature, you're not developing pneumonia, your oxygen saturation is not falling. But other than that, you really just take a good meal and relax, and until you are confirmed to be non-infectious after you've gone through the 14-day isolation period, and then you go back home and join your family. For the vast majority will continue to be well, but it's a small fraction, particularly the elderly, that will continue to have problems and are at risk of dying. And they're the ones that we're most concerned about. And that's why we want to interrupt transmission within the population.
Doctor, did I hear you well that if you have a positive case of COVID-19 and you don't have symptoms, there's no cause to worry, no cause to take all those treatments, the chloroquine that people take over the counter and other treatments, no cause, you should just wait it out? That's if you do not have symptoms.
I'm so sorry, Nancy, I lost you.
Okay.
I lost you for a while.
Okay, can you hear me, doctor? Did I hear you well when you said that if one is positive for COVID-19 but do not exhibit symptoms, that person should wait it out? There's no need of taking drugs over the counter or whatever. Just wait it out for 14 days.
No. And that's right. Because what really matters is whether you're developing complications as a result of COVID or not. And the common complications are pneumonia and a progressive respiratory failure, Nancy. And those complications depend on whether the virus continues to replicate within your lungs or your immune system helps it to recover. So far, all the trials that have been done have not shown that any particular drug interrupts progression from mild to severe illness. It's only when you have a pneumonia or you have a respiratory failure, that's when the steroids are effective. That's when other antiviral drugs like remdesivir probably work best. But what I'm trying to say is if you are in an isolation center, the likelihood is you're being isolated for the purpose of stopping transmission if you are well. You're not being put in that facility to be given any treatment. The primary purpose of being there is really to stop you from infecting others. Whereas if you have symptoms and you are unwell, that's when you need treatment. You might need antibiotics, you might need steroids, you might need oxygen, you might need to be ventilated. So those two are very different.
How about for those that are in Lagos, like you said, Lagos is doing perhaps like a home treatment. What does that entail?
So home treatment, essentially, it's all about keeping you at home, away from others. And if you have a slight fever or you have a headache, because COVID does come with a lot of headache, it's one of the common symptoms, then you're given paracetamol or analgesia. If you have a cough, you're giving a cough expectorant, so you're treated symptomatically. But there's no specific treatment for mild COVID infection. There isn't, or asymptomatic COVID infection. You don't need that. You only need treatment when the complications arise. And I think that's important because we've had in the past a lot of misinformation of people being in isolation centers, sitting down and eating huge amounts of food and saying that they are very well. Of course, they will be well if they have mild illness. And for a young person, it's unlikely to progress into severe illness. But you are being put in that facility for the purpose of being isolated as in transmission rather than for any specific treatment itself.
So does it mean that perhaps we have a lot more symptomatic cases in Nigeria?
Oh, we do. And not only in Nigeria, globally as well. There are a lot more people going around either asymptomatic or very mild symptoms. And that's why even in Nigeria, that's why we are underestimating clearly the number of infections. Because if a young person catches COVID, they will probably just have a mild illness, if at all, for a few days and they will recover from it because it feels like a cold. Even in the elderly, the way it starts off with a bad cold and you start thinking that you will get away with it because it can be quite mild at the beginning. If you're above the age of 65 or you have diabetes, when it starts off, most times you will not even realize that it's going to progress and you'll get very sick. You will think that, oh, I've just got another cold, it will get better. And then progressively it starts getting worse. And then people become more short of breath. They develop a fever, they develop a pneumonia, and then they go into hospital and progress to respiratory failure requiring ventilation. But it can be very deceptive. COVID can be very deceptive at the beginning. And that's why that monitoring aspect, especially if you are within the vulnerable population, is so critical, Nancy. It's so critical. It's an infection that can easily mislead you into thinking that you will be fine at the end of the day, only for a week later to find yourself on a ventilator. We've been very lucky in this country, and I'm very pleased that we have had very few deaths overall compared to other parts of the world. But that's not a reason for us to relax and sit back. We still have a lot of elderly folks that are still at risk, and that's why we're being very careful when it comes to opening schools, because grandchildren can easily carry the infection to their grandparents or to their parents at home. And when students started demonstrating they wanted to go back to university, education is absolutely important for us. But at the same time, they need to realize that they could be putting their parents at risk as well if we do it in a very hurried manner. You could end up losing a parent simply because you've carried it back to them. You will be fine, but your parents may not be. So we've got to be very careful.
So what kind of fear is the government entertaining, especially for schools resumption? Because in Kenya, for example, schools will resume in 2021. In fact, in Philippines, the country had said no school resumption till a vaccine is developed, if a vaccine is found.
So, Nancy, it's a balance. And that's why we have, to a large extent, been advising the state government. Because in Nigeria, education continues to be part of the, it's not really, the bulk of the educational facilities are not under the federal government. So the federal government is not going to come up and say on a single day, 15 September, here we go, we are opening schools. No, what we are saying is the states need to follow the protocol and do a careful risk assessment, because we believe not all schools are at the same stage of preparedness. Some schools have prepared very well. They've got hand washing facilities. They've maintained physical distancing. They've found a way to reduce the number of students in a class. And there's what we call a bubble, keeping persons in a bubble. So, for instance, students will be kept within a bubble where only maybe 10 or 12 or 15 of them are interacting with a teacher. So if one of them gets infected, only those within that bubble will be isolated. You don't need to close the entire school. So things like that. And if a school is assessed and found to be very ready, then you can open up those schools. But there will also be schools that are not at any level of preparedness, and they're the ones that should be most concerned about. Nancy, apart from a lockdown, an effective lockdown, the second most effective intervention when it comes to controlling COVID is closing schools. We all know that. It's been shown repeatedly based on studies, intervention studies, etc. But at the same time, we have to balance this with the need for our children to be educated, especially the children of the poor that do not have access to internet facilities, etc. We don't want a situation whereby next year a lot of our students are hugely disadvantaged as a result of COVID. But at the same time, we have to balance this with the possibility that there could be excess deaths from opening up schools. It's got to be done carefully. We have to work very closely with the state governments. We have to work with the school authorities. We have to make sure that we continue to monitor the situation fairly carefully. And we are learning from the lessons of other countries as well. But this debate, this is a relatively new disease. This debate will continue. There will be people at both ends of the spectrum, some wanting to open schools, some wanting to close schools forever or until the pandemic is over. But Nancy, do you know how long the pandemic might take before it's over? We don't know. We talk about a vaccine being available maybe by middle of next year, but only about 20% of drugs that reach phase 3 clinical trials ever come to light. So in the majority of cases, if you have a drug, even in a phase 3, phase 4 trial, 80% of them will be dropped at the end of the day. They will never see the light of day.
So, Dr. Ali, let me just hold you for a bit. If we don't get a vaccine, let's say in the next 12 to 18 months, does that mean that our schools will be closed till then? Perhaps companies would also perhaps be closed. Is there a middle ground? Is there something in between that we can do for lives and livelihoods to go on?
Nancy, there has to be a middle ground. And that's why we urgent state government to the schools, and the federal government is doing the same. I believe schools need to open, but they need to open in a controlled manner. And they also need to open based on individual risk assessments. You cannot open schools all at once. It has to be staged, it has to be phased, You have to look at how you can reduce the number of students, maybe splitting them into morning and afternoon classes, for instance. Look at using the bubble concept in terms of infection control, and making sure that they understand the implications, particularly those that are boarding, because the biggest risk are really the boarding schools, Nancy, because they sleep in enclosed areas without masks. All you need is one person coughing and spluttering, and they will probably spread it. But we are also thinking of additional things, such as working with the school clinics to make sure that there are sample collection centers in the big schools, where if you have somebody at risk or who might have COVID as a child, for instance, you have the capacity to be able to take a sample and then send it off for testing quickly. But there is no doubt we cannot continue to keep our schools closed. They have to open, but they have to open in a controlled manner, working with the school authorities and the states. This isn't just a federal issue. The Federal Ministry of Education is already working on their own protocol for the federal colleges as well as the universities. But the way I see it, it will be a phased opening. It's not going to be all at once, here we go. And we have to continue to monitor the situation carefully. The education of our children is really vital, and a lot of children have really lost a valuable time. In the north, for instance, we know that the girls that are 15, 16, and their parents may not even keep them at home. They will just marry them off, and then that's it. And that's the end of their education. That's the end of their career, etc. So that risk is there, and it's a balancing game. As you said, we have to balance lives and livelihoods in the same way that we are prioritizing trying to open up our airports and our economy. We also need to prioritize the education of our children, but safely.
Okay.
Safely.
I think I heard the Accountant General of the Federation did say just a few days ago that about 30 billion naira has been spent so far in the fight against COVID-19. I remember also that COVID and some private sector people came up with donations and interventions. I remember, I think in April, I interviewed the Group Managing Director of Access Bank PLC, Herbert Mwigwe, Central Bank and Co. and all of that. Can you just speak a bit about perhaps the funding of this COVID-19 pandemic?
Okay, and Nancy, thank you for bringing this up, because it's something that we need to clarify quite clearly. So what the Accountant General, I think those requesting for the information really didn't get it right. The Accountant General gave the Presidential Task Force 22 billion naira for the COVID response. Out of that 22 billion, 1.2 billion or so was released directly to the security agencies for the logistics side when we were doing the lockdown. About 250 million went to the Ministry of Foreign Affairs for the issue of evacuation of Nigerians. As far as I know, Nancy, we have at least between 18 to 19 billion still with us, of which about 8.4 billion, if you recall, recently was approved by the Federal Executive Council for procurement of items through NCDC, Nigeria Center for Disease Control. That procurement makes the money committed, but it hasn't been spent. So we have at least 18 to 19 billion out of that 22 billion. Secondly, we have a dashboard. We have a transparency dashboard. For people who want to know, all you need to do is to go onto our State House website. statehouse.gov.ng/COVID-19. And on the right-hand corner, you'll find the transparency dashboard. If you click that, you will find all the donations that have come to the federal government. The money that was that came to CACOVID, the Coalition Against Coronavirus Disease, through the Dangote and the banking sector together with the CBN, was money that stays with them, and they decide what to do with it. Not a single penny kobo will come to us. There's also money from the UN Single Basket, and again, they have their own board, of which I am on that board, and we help them to decide the priorities. But all that is transparently there. Having said this, we are incredibly grateful to the private sector, in particular the CACOVID, the NMPC group, and the UN Single Basket, because they have really helped us to get on top of this epidemic. Opening of the international airport, for instance, would have been impossible without the private sector as at now, because it was done in a much faster way. Getting that portal up and going was really because of the commitment of CACOVID to the cause. Otherwise, we probably would still have been going through the process of trying to get a portal and opening up our international airports. So the message I want to put out is, no, we haven't spent 31 billion in 4 months. We've definitely underspent, The bulk of our 22 billion is still with us. Some of it has been committed, about 8 billion out of the 22 has been committed but hasn't been spent. And we still have at least 11 or 12 that has not even been committed yet, but is part of the budget. And we are going through the process with the different ministries to make sure that whatever they apply for is justified. But we are truly running a transparent system that is very strict, and that's why they're taking a while to spend.
Okay, Dr. Aliyu, are there talks with like Russia over vaccine or any other country over vaccines? Hello, Dr. Aliyu, are you still there? Hello, Dr. Aliyu, are you still there? Okay, Dr. Aliyu, can you hear me now?
Yes, I'm sorry, I lost you.
Okay, I was asking earlier if there are talks with like Russia or some other countries over vaccine, and what is Nigeria's relationship with Africa CDC and other countries in Africa battling COVID-19? I'll need you to answer that in 30 seconds because I have another question before we go.
So we continue to partner very, very effectively with other parts of the international community. We are interested in the vaccines. There are at least about 7 candidate vaccines that are currently in phase 3-4 trials, and with Africa CDC. But all I can say is whatever vaccine comes through, it has to go through the normal process for validation, both in country as well as internationally, and it has to follow through due scientific process. Okay. The days when people can secretly produce a vaccine, secretly trial it, and then give it to others has passed. It has to be done in a very transparent manner. We need to know what the studies show. We need to know the side effects of the vaccine. We need to know how effective it is.
Okay, but for those that say that there's still no COVID-19 in Nigeria, that it's a work for the boys, so to speak, and they are not adhering to the safety protocols. Very quickly, in 30 seconds.
And Nancy, so what I would say to those people is, not only is it incredibly naive, it's also very insensitive. For those of us who have lost family members, who have lost close friends to the COVID pandemic, to say that COVID does not exist. The world will not create a failed pandemic to bring down their economy. Look at what's happening in Nigeria. Look at the US, the state of contraction of the US economy. Look at the UK, they've lost 17 years of growth. That cannot be for nothing. So what we are trying to do is to reduce the risk of death within our people and make sure we continue to have a healthy population. It's the only way we can grow our economy. Creating a pandemic is the last way of trying to make money. If you want to make money, you wouldn't create something that would destroy you in the first instance. So my plea to them is get on to understand what we are saying, work with us. If you work with us, if everybody follows the non-pharmaceutical interventions we have been promoting, this thing would have been over a long time ago. Nancy, we shouldn't be in this state if we had done what we were supposed to do. By April, May, this thing would have been over. Here we are in September, and we don't even know when it will stop. So please, let's be sensible. Let's wear masks. Let's protect ourselves. Let's get back to normal as quickly as possible.
Okay. Finally, Doctor, you are the national coordinator. How many times do you wash your hands in a day?
Nancy, as much as I can.
Okay, I think we will leave it at that. Thank you very much for speaking with me today. Thank you.
Thank you. Thank you. It's a pleasure.
All right, that's the much we can take. I've been speaking with Dr. Sani Aliyu, who is the National Coordinator of Presidential Task Force on COVID-19. That's for the control of COVID-19 in Nigeria. Thank you all for investing your time with us. You've heard him. Let's try and keep safe and believe it that there's COVID-19.